Hey guys, it's Dr. Martin Smith. I'm a board certified allergist and I'm also the founder of Untoxicated Skincare. Today I'd like to talk about a question or a comment I get in my office a lot. People don't know that you can get more than one type of eczema. So there are actually 9 different types of eczema. So the most common form of eczema is something called atopic dermatitis. And this is what most people think of when they hear the term eczema. So this is an itchy, red, scaly rash that usually appears in patches. So it can really affect anybody from infants to adults. The second form of eczema is called contact dermatitis. This is an allergic reaction that happens when your skin becomes in contact with an irritant or an allergen. This causes a itchy, scaly, red rash with little bumps or blisters. And common triggers for contact dermatitis include things such as personal care products that contain allergens and irritants. These include fragrances, preservatives, surfactants, and even sunscreens. Trying to identify what you are allergic to in your personal care products often requires you to go to an allergist or a dermatologist and get something called patch testing. A great place to start is to always use unfragranced products and products without certain preservatives which contain parabens and formaldehyde releasing agents. The third type of eczema is seborrheic dermatitis, often called dandruff in adults or cradle cap in infants. It usually affects infants that are about 2 months to 12 months of age, and then older adults in their 30s and 40s. Common places it shows up is dandruff on the scalp, also on the sides of the nose and behind the ears, and sometimes in the eyebrows. Next up, we have nummular or discoid eczema. It's called that because it causes red, raised, coin-shaped spots where it appears. This usually occurs in people over the age of 50 and affects men more commonly. It's usually found on the arms or the legs and sometimes the lower abdomen. The fifth type of eczema is something called stasis dermatitis or venous dermatitis, and these are red darkened patches that usually occur on the lower legs. This usually occurs in older individuals with venous insufficiency or heart failure and happens on the lower legs where there's increased swelling or water retention. So treatment here really focuses on decreasing that swelling. The next type of eczema is called dyshydrotic eczema or palmoplantar eczema. This is a very itchy rash that usually shows up as little small blisters. It's most commonly found in young adults and it appears in between the fingers, also on the palms and on the soles of the feet. At number 7, we have something called neurodermatitis or lichen simplex. This is eczema that basically develops due to increased skin itching. This usually affects people that are in between the ages of 30 and 50, and it affects slightly more women than men. The areas that it likes to affect are the hands and the wrists, the feet and the ankles, the elbows and the shoulder, and then also the scalp. Next up, we have asteatotic eczema, and this is basically eczema due to excessively dry skin. It usually appears on the lower legs more commonly. And last up at number 9, we have something called juvenile plantar dermatosis or JPD. This appears as a red glazed cracked rash that usually appears on the soles of the feet. It usually affects kids between the ages of 3 and 14, but usually resolves with age.